This is Robert Kraft, and I'm coming to you live on SNN.Live, and we're at the LD Micro Invitational 2019 in Bel Air, California. With me right now is Michael Chermak from Ozop Surgical. It's a publicly traded company. The symbol's OZSC. Michael, welcome to SNN.Live.
Thanks, Robert. Glad to be here.
Great to have you on. So for our audience, let's start off with an overview of the company, and we'll go from there.
Sure. Ozop Surgical focuses on the development of minimally invasive surgical products primarily aimed at the spinal market.
So let's get a history of the company. When did it start, and how did you develop to where you're currently at today?
Well, it's something we've been working on for several years, actually. And about a year ago, we reverse merged into a public entity, and we're able to exclusively license a phenomenal IP portfolio, which really complemented some of the additional IP that we've developed over the years, surrounding what we believe is the next generation of surgical devices.
So I want to talk more about now is the company's value proposition. You know, where do you fit in the marketplace, and what makes you unique and different when compared to your competition?
Well, the focus for us really is on we're looking at a big market problem, and we're looking at addressing it with a big market solution. 1 in 3 people will suffer from back pain in their life. This is about a $90 billion problem. At the same time, let's look at back pain as related to age. And as we age, our discs tend to degenerate, and we have more and more back problems. Let's also look at the changes in surgery over the last 30 years. 30 years ago, if you had a problem with your knee, they'd give you an 8-inch incision. You'd be in the hospital for 5 days where they repaired your ligaments, and in a cast for 6 weeks, and it could be a 6-month recovery. Today, you have NFL players, tearing ligaments in week 2 of the NFL season, and they're back for the playoffs. Minimally invasive surgery, laparoscopic surgery, was a game changer for that. Let's look at gallbladder surgery, appendix. Now it's a same-day procedure, very simple. Probably no specialty has been affected more than or impacted more than cardiothoracic surgery. 30 years ago, everyone got what the surgeons called a zipper or a sternotomy. They'd crack the chest. And oftentimes the complication, cost, discomfort, came from the surgical approach more than just the surgical fix. Today, Mick Jagger can get a new valve for his heart minimally invasively. You can get a stent through a vein or an artery. You can get a coronary artery bypass graft, they call it cabbage, through a small keyhole opening. So it's really changed cardiothoracic surgery and improved outcomes and lowered costs. So spine is kind of a late comer to that, and that's because you're talking about inserting large appliances into the spine, what they call inner bodies that fit within the disc space to restore disc height. And large objects don't fit through small openings. So you need a large opening to accommodate a large object.
So how are you providing the solution for that problem?
Well, what we're developing is something called our B-lift procedure. And we've got extensive clinical videos on our website. And that stands for balloon lumbar interbody fusion. We've got a whole IP portfolio around this procedure developed by a brilliant neurosurgeon friend of mine who's developed, who has performed thousands of spinal fusion procedures, and has also developed products that are in the market today, licensed by some of the leading orthopedic companies in the market.
So are your products currently on the market right now, or are we still in development?
Well, we have some. We have an expandable product coming out in about 6 months. That was just announced a couple days ago, and that video just went up on our website, which is a next-gen product. But the real breakthrough product is one in development now, which we hope to have out sometime in possibly 2020. And that is inserting really a balloon into the disc space. And I'm abbreviating the procedure now, but you can watch the video for the full description of how this procedure is performed. It's the shape of an inner body. Fill it with a flowable material that hardens in space. And this is a outpatient, probably 30-minute procedure under local and possibly nerve block versus up to a 4-hour procedure of general anesthesia and multi-day hospital stay.
And what's your background? I mean, how did you come into all this?
I've been in healthcare for about 38 years, since the beginning of the Reagan administration. And I've built a healthcare data company that I sold. I started what became the largest healthcare B2B in the country. I ran a venture fund with a partner of mine, and I've worked on all sides, both sides of the table. I spent 6 years as a CEO of a public biotech based in China, which was both challenging and exciting at the same time. And I've worked on the public market side, the private market side, in kind of all areas of healthcare, and I've been tangentially involved in spine for 7 or 8 years now. And I had the good fortune to meet this neurosurgeon a brilliant gentleman who had developed someone I thought were world game-changing products, and got together with some folks and put together a team and developed a company around it. Yes.
So from what you can tell me as a public company, what are some of the company's growth drivers now moving forward?
Well, some I can speak about now, and some are in development, which I can't address unless everyone out there would like to sign an NDA. Getting products into the marketplace obviously is number one. And we've got a few other things under development that we believe will propel growth and provide tremendous value for our shareholders.
And where can our audience go and find more information about the company?
OzopSurgical.com, OZOPSurgical.com.
My name is Robert Kraft, and I'm coming to you live on SNN.Live, and we're at the LD Micro Invitational 2019 in Bel Air, California. With me again has been Michael Chermak from Ozop Surgical, publicly traded company. The symbol is OZSC. Michael, thank you for joining me today.
Thank you very much. Really appreciate it. Thank you.